Surgeons, doctors have read it. What's the dumbest thing patients have lied about? Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullcrap from their tone. Patient in for routine colonoscopy, asked if solids consumed in 24 hours prior. Patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. Story 2. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke, but they'll tell me they don't write to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprised Pikachu face. Story 3. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Story 4. Paramedic here. When I was in ambulance, a PT couldn't track us with either eye but claimed to not be blind. She wasn't altered, not even confused. So we asked family. They confirmed she was totally blind in both eyes. How is lying about that going to help? Story 5. 1. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up inside of me. Anybody want fries while he's waiting to get it removed? 2. Me. Have you had anything to eat or drink today prior to your surgery? Patient. No. With a half-eaten candy bar in front of them. Me. Are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you pass away. Patient. Then yes, I have. I had half that candy bar. 3. This one guy repeatedly used to come in saying he hadn't crap in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in who wouldn't be wise to his tricks. 4. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, they did that last time. I didn't like it. 5. I fell down onto my couch and a cucumber was sticking up between the cushions. It went right in. Story 6. Patient who denies substances use for an otherwise unexplainable heart attack with a positive substances test, stating they were positive because of transmission from semen, but what do I know? Story 7. Do you have any medical problems? No, so no diabetes, no diabetes. What medications are you taking? Metformin for my diabetes. I facepalm every time. Story 8. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was, and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's tacking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness. And he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one. But it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time, they book an appointment only to talk about recent trivialities, which makes them clearly better. Although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Story 9. Their age. Had a woman say she's 30 when she clearly didn't look it. Oh, well, I move on to other questions. Look at her files, and lab reports have her real age on them. 41. Like I, though? What difference does it make lying to healthcare staff? This is health-related, not your Tinder profile. Nobody going to see this and go, isn't dating an old lady. Bet you she was married with children. Story 10. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the MD, And when I walked back in with the doctor, she looked at me and said, "I didn't think you'd be coming back in the room." And then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. Story 11. Outpatient came in, and when they got anesthetized and flipped over, there was a little baggie of met neatly in the butt crack. Surgery canceled, and when he woke up, he said my wife must have put that there as a joke. Story 12. Woman comes to emerge with complaints of pussy discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body inside. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that. We heard it would improve our fertility. You can't make this crap up. Story 13. One of my favorite things I wrote my first year out of medical school. Please note, patient has stated multiple times that he wants to leave and would leave against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, patient was complaining of a headache, was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic bleed from taking too much aspirin. Story 14. The patient, I haven't drank alcohol in months. Patient's family, it's true I've been with her the whole time. Me, ma'am, your alcohol level is 325. Patient, impossible. I would never lie to you. Story 15. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse. Patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure, and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him, and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain, and he asks for intravenous substances. I tell him no because this story makes no sense. It was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV substances. Also, the MRI was normal. Story 16. My little brother was a nurse for about a decade. He has said many times that people stick anything inside, from light bulbs to hairbrushes to a golf shoe. And at first it's hilarious. Then after a year or so, it's not funny because you've seen way too many distended holes inside of him. Then after a decade or so, it starts to get funny again because you think you've seen everything. And then one day, a 45-year-old man is driven to the hospital by his wife, and he has a golf shoe inside of him. And he told his wife that he and the boys were golfing, and he slipped in the locker room and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Story 17. Nurse here. The absolute dumbest thing patients have said, and to be fair, this was the patient's parents, since I was in pediatrics, but still dumb AF, and caused no end of grief trying to unspin it. I was rooming patients, and I went to the full lobby and called the next one in by last name. They stand up, and mom and dad bring the little girl back. I'm rooming them. Take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies, and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient. Where is my patient?" I'm like, what the heck? I go in and ask the parents, and no, in fact, they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no violations, which fortunately there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know. Like, how does that even play out in their minds? Story 18. Paramedic here. The most common one? Oh, have you had any substances or alcohol today? Patient. No, me and my partner counting the 6 bottles of rum, 2 Mickeys of Fireball, 12 beer cans, 3 wine bottles, and an open vodka bottle in the patient's home. Meanwhile, the patient is currently sipping on a beverage that smells suspiciously like vodka. Story 19. I had a patient that lied about having a job. I asked because he had hepatitis A, and I wanted to know if he needed a medical leave. He denied it, even though I asked twice. Next day, he came back because he was going to get fired if he didn't provide a doctor's note. Story 20. First baby, never pregnant before. New obstetrician appointment. We collect everything and do exam. I put a speculum in and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner know that she's a single mom. Not dumb, but just very obvious on an exam that she has definitely given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. Story 21. resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for death ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breast complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues. But we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Story 22. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a lot more than $200 for emergency surgery. Story 23. My girlfriend was in a mood with me and I thought I'd cheer her up by juggling knives and then I accidentally hit myself in the thigh, said by 19-year-old patient. Not a single person believed this nonsense. Story 24. The worst I've heard was from the ed. Common question before shooting an x-ray is how'd it happen because I may have to use an optional position or something. From women. I tripped on the rug. I dropped a heavy box on my hand, foot. It was dark and I didn't see that the door was open. There's always a social worker in the eddy and we'd take her to imaging for better shots. Sometimes radiologists would order a series. Suspected non-accidental trauma. Where there's one break, there's always a history of more. Story 25. I work in ophthalmology. I see patients nearly every week that are faking vision loss. Most often, it's to try to get disability. Sometimes it's just attention-seeking or extreme stress, anxiety. In rare cases, patients truly believe they cannot see or have convinced themselves they cannot see when all exam findings and testing are normal. It's called non-organic vision loss. Story 26. Not a doctor, but in patient care nonetheless. 1. Guy comes in between 19 years old for pebble hits junk. Pretty odd. He says he was doing yard work when the tool knocked a pebble into his junk. He went to check it, and now it was making pus. Nurse clarified that he was wearing pants. Denies sexual history. He stands by that he got hit on his junk by a rock through his pants that made him produce pus. He had chlamydia. 2. Guy says he was forced to do MIT or something similar at a store. Came in because he thought he was dying. 3. A fun bonus. A frequent flyer comes in for his stomach hurting from eating this chili he had. While continuing to eat said chili in the lobby, woman comes in after doing substances and states, now she feels sad. That's all we got. Older woman who owed it on something says she thinks her son poisoned her, who she hasn't had contact with in years. Guy came in for vomiting on Thanksgiving because he ate too much, but it was really tasty. No other complaints and felt fine now. Addict left AMA because he had to go to Met right now. He was in for other issues, but had to leave immediately to do more Met. He eventually came back for treatment, thankfully. Story 27. Whilst rare, hiding symptoms to see if I can get the diagnosis correct or some alteration of this game which in their judgment determines if you are a good doctor. I see the smile on their face when it coincides with what is happening. But I get frustrated because it took me 40 minutes to extract that information through questioning during which they hid crucial info. Another doctor would have long ago concluded the wrong diagnosis and the outcome would be at best ineffective and worse lead to death, sooner or later depending on issue. Story 28. Anything, to be honest. I honestly don't care what you do or don't do. Usually if I'm asking, it's because it matters for your healthcare. And if you lie about it, all you're doing is putting yourself in danger. As a more real example, I've had a post-transition patient lie about the sex they were born with. I understand it's hard to deal with a lot of the medical community that can be judgmental, but this patient ended up having prostate cancer. Only found out after we scanned them. Another one lied about having prior back surgery before I was about to send them for an MRI. Did a physical exam and saw the scar. Asked again, and they just said they didn't feel it was important and didn't want me to assume it was related to previous surgery. They were there for back and abdominal pain. Story 29. I recently had a patient double down to the point of yelling that I never told her to stop her aspirin for a lung biopsy. During our clinic visit, she told me she didn't think she took it anymore. But I reiterated it multiple times, including asking her to check if she took a brand name, and wrote it in my clinic note in 2 separate places that we'd discussed it. Sure enough, she arrives and says yes, she takes it, and no one told her to hold it for 5 days. Yes, ma'am, we did. Well, it's Monday. Our clinic appointment was Friday. How would that make any sense that you told me? Ma'am, the appointment was last Wednesday. Oh, I just don't remember. Just open with that and we'll reschedule you. It's fine. Story 30. Medical school student. Not a big deal, but a patient lied to me about what she had eaten. She was obviously having some problem with her gallbladder. Typically, this pain can be caused by greasy food. So I asked the patient what she had eaten before she got this pain. The patient said she only ate a salad with very little ranch. That's it. I even explained how greasy food can cause this pain, but she's adamant she only ate a salad. Anyways, I report back to my attending and we see her together. The attending asked her what she ate. The patient said salad, then adds she also ate a burger. It wouldn't have changed the plan, but why lie? Story 31. Not yet a doctor, but soon to be. It's not uncommon for patients to lie about substances use. I am a former addict. I will know, be sure of that. Please don't do this. It's one of the most important things for us to know. And you won't, at least shouldn't, be reported, frowned upon, or whatever. Story 32. Not a surgeon or doctor, but an anesthesia nurse. But a mom directly lied to us about her 12-year-old pre-NT surgery. We always confirm with the patient and legal guardians all the pre-surgery checkup. Name, age, date of birth, any past medical history, common medication, and medication took in the last 24H surgery proposed, last time you eat or drink anything. The thing is in the last item of the checklist. The mom lied. Her answer, no, he doesn't eat anything since yesterday. The kid confirmed. Note that it was 4 p.m. Outcome, surgery went well, no problems. When comes the time to remove the tube, the kid starts vomiting tons of rice and beans. When I say tons, I mean at least 1 kilogram of said food. The kid aspirates part of the food against our best efforts. We aspirate, do everything we can, including a bronchofibroscopy. Everything ends up okay. The kid survived, no further complications, and recovered to full health in only 2 days. When confronted about the lie and explained how her son could have died, the Karen mom said, "What could I do? He was hungry and eats like a bull. Who am I to say he can't?" We all lost our patience and just said, "His mom! He could and was close to dying because of this." Story 33. A girl arrived to the rural hospital I was in because of shortness of breath. We were thinking it could be COVID, so after the first assessment and stabilization, a chest x-ray was taken. She had a 50-cent Mexican peso coin in her airway. When we asked the mother, she completely denied the fact that she had swallowed a coin, despite the fact we were showing her the x-ray. After a while, the granddad of the girl arrived and finally told us that indeed she had swallowed a coin. But it was 6 months ago, and in the end, they didn't bother to check what had happened to it. Story 34, sort of the opposite, but I have an ankle that I've sprained quite badly twice. After years of PT, I managed to rehab it back to full strength, but I never recovered full range of motion. It's close. Years later, I was playing football in the snow with a bunch of teenagers. One of them tackled me and it went the other way, opposite of the prior sprains, and broke. I hobbled back to the cabin and went to the ER the next day. They referred me to a specialist a week later. I gave this guy dates and times for the previous injuries and the one I had at the time. I was as specific as possible, and he went all Dr. House on me, told me he didn't have time to be lied to, and stormed out. It was damn weird. I got in to see another specialist, gave him my history. He helped me build it back, and after another year of PT, it's as strong as it ever was. Still about 90% range of motion. I never understood why that first doc was so sure I was lying. I imagine it was because of the buildup of scar tissue and bone. Even now, it's visibly larger than my other ankle. Story 35. Anesthetize people at work. It's important to know what substances someone's body is used to so we can tailor an anesthetic. Rarely IV substances users deny taking substances even when they're having surgery for an abscess due to a skin infection from injecting. It's on them. They're at higher risk of being aware under surgery if they're met addicts or not having any pain relief if opioid addicts. It becomes readily apparent once truckloads of opioids don't work. Funnily enough, no one in 5 years has ever admitted to being addicted to substances. Most addicts are fairly open with their substances use. My favorite was a guy that denied any substances use, was pretty apparent after 6 times a standard induction dose as he was merrily chatting away to us, relocated his tibial and fibula fracture while he was telling a story. Story 36. My wife is an obstetrician, gynecologist. "Ma'am, do you currently have something in your pussy?" "No, I don't think so." Pulls out sex toy. "Well, I just found this." "Oh, I've been looking for that." Story 37. Their identity. Insurance fraud using a friend's relative's insurance card. As a resident in a very large East Coast hospital, I was tasked to figure things out when the blood bank called and said their blood type changed. When confronted with getting the wrong blood that may kill them, they almost always tell the truth. This type of fraud has also resulted in people who have been dead raising from the dead and appearing in a clinic. Story 38. I used to work at the men's prison. Had to wade through a swamp of lies every day at work. I would say my favorite to date is the one time a guy lied about how many balls he had. He said he needed opioids for the severe pain he had after getting one of his balls removed. So I asked him to please drop his pants and show me the surgical scar and low. And behold, both boys were still hanging in there. Story 39. Retired paramedic here. The dumbest thing I saw patients lie about and think we'd fall for? That's tough. It'd be either the unconscious fakers or the substances seekers. The way to quickly check if a patient is conscious or not is, I touched my gloved finger to their eye. If you blink, I got you. That's when I'd get down on the floor and say, I know you're faking. Here's what we're going to do. I'm going to help you up, and you're going to get up, act your age, and stop freaking your family out. The seekers were always, I'm allergic to most painkillers, but I'm not allergic to the, how you say it, lauded stuff. Straight to triage you go. Story 40. In the emergency, 4 a.m., teenage girl and her parents arrive. She's been constipated for days and no poop has come out at all. I was busy, so I asked the nurse to check if the patient indeed has poop and needs an enema, so a rectal exam is needed. A few minutes later, the nurse urgently called me. When we uncovered the girl, she had tons of clothes. We just saw this cute little head popping out, a baby on the way. Why didn't you tell us that you were pregnant? I asked. I'm not pregnant, she kept saying. She lied to her parents, don't know how to this day, the whole pregnancy. She lived with them. I had to explain everything to the parents. They didn't have a clue, and judging by their face, I believed them. Story 41. A 13-year-old girl that went to the ER to have a baby and said she didn't know she was pregnant and that she didn't have sex. Mom was wondering why she was always wearing hoodies. I was like, okay then, keep your secrets and informed authorities to investigate. Apparently, the girl had a boyfriend her age and they just were really horny. She came back another 2 times to deliver babies, at 17 years old and 21 years old. Same dad apparently working his ass off. She then opted tube ligation, eventually became a nurse. Story 42. Weirdest sex lie. I was chasing the dog while vacuuming naked and bumped into the pencil, causing it to go into my bladder. Most common lie. About the volume and types of substances and alcohol they use. So sick of the shocked Pikachu face when I ask about how much they use instead of if they use. I genuinely don't care what they do in their own time, but the information is really important. Story 43. Not me, but my mom used to literally tell my doctors I'm lying about my headache. They'd believe her because I was a child, and I never really showed my pain. No screaming, crying, just quietly explaining that it hurts. When I was 16, we had to get me to an ER because what started as another headache slowly turned into me passing out randomly and losing the memory of entire weeks over the course of a few months. I wasn't in fact lying. I was, and still am, but now I'm treated, suffering from a chronic illness that could have killed me if it went undiagnosed and untreated. Story 44. Had a friend who is the emergency driver tell me about a call she responded to where the guy was barely coherent or audible in his 911 call, but managed to get 2 pieces of information out perfectly, his address and the word stomach. When they arrived, the man was covered in a blanket, sweating profusely, though he looked like he hadn't moved in days. My friend said that she immediately observed that even with early signs of his skin showing jaundice symptoms, that his cheeks remained rosy red, and he avoided eye contact and answering any questions. The only words he would speak between groans were poison and stomach. My friend took a quick look around to see if there was any chemical bottles out, but didn't see anything. Just as she was returning to the ambulance, she noticed that there was a large pot on the stove that had a low flame on it. She turned the range off and removed the lid of the pot and was startled to see a dozen naked Barbie dolls. When she informed the man that she had turned off the range, he became erratic and aggressive until he was dropped off at the ear. Later in the day, she ran into a friend that worked in radiology, who told her that the entire time the man only answered the word poison as to what he ingested. When they told him that they would need to x-ray him, his demeanor completely changed. Calmer, communicated clearer, but accepting that the truth was around the corner. X-ray results showed that he had ingested 18 Barbie doll parts and were locked up in his stomach for nearly 2 weeks. He explained that he sterilized the Barbies in hot water and that they were the newer plastic because the older material was caustic to internal organs. The surgeon apparently ended his conversation by asking him why he would ingest the Barbie doll parts. And the man replied, "Because I like the way it feels when I crap them out." Story 45. Dude came in asking for a second vasectomy. It's been 10 years since his first vasectomy with numerous sperm counts all being 0 throughout the years. He now has a new baby. His sperm count is still 0 and wants the vasectomy fixed. Didn't know if he was lying to himself or not. Story 46. Former ear nurse. Not a lie, but a very vague explanation. I'm taking a brief history on a patient with shortness of breath. I ask about any cardiac conditions. She says, I have a thing in my heart. Despite all kinds of follow-up questions, I couldn't get any answers out of her about what was in her heart. Did you have a surgery or procedure to put something in it? Is the thing something you were born with, like a hole in your heart? Are you on any medications for it? Was it a clot? Does that sound familiar? I listen to her heart. No murmurs or clicking of a mechanical valve. I take a look at her chest. No surgical scar or pacemaker battery. I never did find out what was in her heart because my shift ended. It was a fun conversation with the ER physician, so she has something in her heart and I have no clue what. Have fun figuring this one out. Story 47. Med student ATM. But when I was shadowing a surgeon in college, he told me about the time he had to remove a Power Rangers Megazord from a inside of dude because he was cleaning his son's toys with his clothes off. Apparently, everything was so dirty he decided to strip and just slipped onto it. Story 48. In my 11 years of general practice, these are the top few. 1. Alcohol intake, mostly assault cases. 2. Medical, surgical history, mostly in legal cases. 3. Age, since it is illegal to attend to a minor without the knowledge or permission and presence of an adult parent or guardian. 4. Timing of injuries. In my country, people generally do not seek medical aid unless they fear they might die, not see results from their home remedies, or they may gain legal compensation through accident or injuries, and the delay in getting medical documents processed. Story 49. X-ray tech here. Did you follow the doctor's instructions on the prep? Yep. This for a barium enema. Had one guy where we barely got the bag to flow in a scout. He was literally full of crap. Ascending, transverse, descending, sigmoid all full. We got about 20 milliliters in. Now here's the problem. After a B, you're supposed to drink 2 to 3 quarts of water as quickly as possible to flush your system because the barium left in you. You don't expel it all when you go to the toilet right after. Will harden and cause real problems. So we had to get a PA that happened to be walking by to examine the PT and order an enema, which was done elsewhere. Never saw the guy again. We quit doing BS except in rare situations. Story 50. Having spent some time in trauma surgery, all the gangbangers who come in with a bullet wound tracking through their ball and left upper thigh, they all claim some guy managed to pop them at exactly that specific trajectory. But the more likely pattern is these guys are shooting themselves in the balls trying to pull their gun out of the front of their waistband with the safety off and are too embarrassed to admit it. Story 51. As an anesthesiologist, my favorite one is when tough guys say they are nearly impossible to put to sleep. Usually they've had some minor procedure in the past under mild sedation and recall that they weren't fully asleep. I can never convince them that they have no chance of staying awake under a real general anesthetic. I am undefeated. You going to sleep, my friend? See you in recovery. Story 52. I'm an emergency doctor, and I've literally heard so many lies that I've probably permanently forgotten thousands of them. Recently, I saw a lady who was obviously pretending to be nauseous, and she was carrying a napkin folded around something that she claimed to have just vomited up. She swore it was nothing she had eaten. To me, it looked like some kind of caterpillar, butterfly pupa, larva, or something like that. I touched it, and it kind of felt soft, like a worm, but was a weird gray, off-white color. I sent it to be analyzed by pathology, and they reported it back as being a rubber or latex worm, likely a fishing lure. I'm still not quite sure what her motivation was, aside from just possibly doing it for attention. Story 53. I was in med school. Elderly patient was admitted to the hospital, medicine ward. She had these pressure ulcers, ores on her skin, which develop in persons that are bedridden and can't move on their own, so the skin gets sandwiched between the mattress and their own bones, causing ulceration, but this takes a long time. And her daughter, adult woman, tried to convince me those sores developed because her mother had been waiting a couple hours on the emigrancy until everything was ready to get her to her hospital bed. A few days later, I listen in on her daughter talking to the head of medicine and the doctor in charge of her mother's case about treatment options and whatnot. The following morning, I do my rounds, and when asking about the patient, this woman goes, "The other doctors told me there was nothing to do for her." And I was like, "No, lady. They told you exactly what we're going to do for her." But since I was the student, I had to keep quiet and nod. Story 54. Not me, but an anesthetist buddy screening a patient before getting anesthesia. "We see that your substances screen came positive." I don't know how. I don't do substances. "We can't go forward with anesthesia. We won't know how the anesthetic will react with these substances." "Oh, I know. My boyfriend does substances. I kissed him before I came in this morning. That must be how I tested positive." Story 55. Once had a patient lie about an overdose. That's not terribly uncommon. In fact, it's more common than not. But the lie was so beyond comprehension, it is stuck in my head for a decade. He proposed he never uses substances. He was sleeping on a friend's couch, and the friend wanted to play a funny prank. The friend had injected him with substances as a fun prank, but because he never uses substances, he instantly overdosed. There are a lot of holes in that story, but he really dug his heels in and swore it was true. Turns out, wasn't really that funny of a prank. My advice was to find new friends. Story 56. High-speed MV, unrestrained passenger in the front seat with both feet on the dash. Fractured her pelvis pretty badly. Consult from orthopedics to identify an odd structure in the region of the soft tissue of the pussy before they try to fix the pelvis. PT adamantly denies anything is in there. Finally consents to an exam when she's starting to decompensate from a slowly expanding hematoma, performed under anesthesia in or roll of cash in a baggie the size of a Campbell's soup can. Story 57. Veterinarian here. If your dog ate substances, just tell me. I'm not going to call the cops. I am absolutely flabbergasted by the number of people who will swear up and down that their dog couldn't possibly have gotten into any substances, when the dog in question is obviously stoned out of its mind. It's frustrating because if the owners are insisting the dog couldn't have gotten any substances, I can't in good conscience not recommend a full workup with a bunch of expensive lab work and treatments, when what a stoned dog really needs is to be left in peace in a dark, quiet place with some food and water to sleep it off. Story 58. Nurse here, not doctor or surgeon, but worked in surgical service line, pre, peri, post, for several years. Background info. Substances in the system ducks with anesthesia in a life-threatening way. These are common recreational substances, so to make sure we don't have dozens of people dying on the operating table every year, we ask every pre-op patient as a standard screening question when they're getting prepped, and include the info about it in pre-op clinic paperwork. Well, this guy must have missed the question in clinic or on his day before surgery confirmation call. He feigned outrage upon being asked this standard question. Tried to explain it to him? No dice. He called me and the CNAA who was with me a slew of mean-spirited names. Demanded to speak to the CEO. We aren't a private hospital. That's not even the title we use for our main executives, but all the same. It took a supervisor, a chief nurse, and a surgical attending to finally calm him down. He had missed his appointment window and was bumped. We got him into a bed and he rested for a bit. Had a chat with one of the surgeons about a hunch I had. Despite potentially getting this guy to flip out again, she backed me up and got him to agree to a tox screen. Guess who came back positive for med? So yeah, dumbest thing a patient could lie about. This guy wanted to sue the hospital for being asked a screening question that we ask everyone to prevent potentially fatal reactions. After asking it and being told exactly what the outcome would be, he still lied anyway and only survived because he decided to throw a damn fit in the prep room and missed the appointment that would have killed him. Story 59. Surgical nurse here. It's always the little things that are just so stupid. Lying to your anesthesia team about smoking AA. It affects your reaction to intubation and can make it difficult, dangerous, unexpectedly. B. In non-emergencies, any pre-op chest x-ray will tell them anyway. C. Once they do intubate you, they will know. Lying about fasting before surgery. Your stomach needs to be emptied, so when we put a tube in to hold your airway open, the contents of your stomach don't attempt to kill you by going into your lungs. It's not to be mean. You will not die not eating for one day. We require it because it's best for you, which is all we ever want. Story 60 made me think of a funny story. Wasn't a lie, but the truth. In my 20s, I ran with this party crowd. We partied hard on a Saturday night, and everybody crashed at our friend's apartment. We got up on Sunday morning and popped some beers and smoke. One friend started having heart palpitations and asked me to drive him to the ER. When we got in to see the doctor, he asked what was going on. My friend told him about the beers and substances. The doctor gave him this shocked look, and my friend said, "Yeah, you know, just a normal Sunday morning." I had to laugh. Story 61. I have one right now. 60-year-old male hospitalized for an infection following a spinal fusion. He had surgery to remove the infected hardware and has a cervical collar, neck brace, to stabilize his spine, and a treatment plan that says to keep it on all days for 4 weeks. It's been 16 days and he removed it Sunday night. When confronted, he told me that he had cleared it with his surgeon and told them he had removed it. He had not. I explained that he has an extremely unstable spine and the wrong move could result in irreversible quadriplegia, to which he responded, "I don't think that's going to happen. Even if there's an explosion, I'll hold real still." On the phone with his sister, shouting into the speaker, he said, "Well, I took it off because it was so uncomfortable. At first, my neck was real stiff, but I shook my head a few times and something in there broke loose. It feels much better now," while his nurse and I stared at each other in silent horror. Story 62. Years ago, 2 firemen that were injured on the job were admitted to our unit. Both shared a room since we did not have private rooms, 2 patients per room, and they wanted to be together. The firemen thought they will play a trick on the nurse, so they switched beds and went by the other's name. The nurse was doing the vitals, assessment, and starting an IV on the one fireman and documenting it into the chart. She was ready to administer the medications and looked down at his hospital band, realizing that this was not the correct fireman, patient. He was going to take it too, both firemen smirking like school kids. The nurse was so pissed, saying what dumbasses, and began to lecture them for their child game. The fireman was going to take the other patient's blood pressure meds when his not history of high blood pressure. Story 63. I had a patient that came in because of previous history of bladder cancer. I ordered a urine sample and told the patient I would start working him up after confirmation. The lab called and told me the urine sample looked like straight-up water and was cold as if he just opened the tap and filled it up. I called the patient dumbfounded, and at first he denied it but later came clean and said he couldn't urinate so he filled it with water. No clear reasoning why. Long story short, he had cancer. Story 64. I had a patient in the hospital who wasn't taking any of her meds at home but kept picking them up and paying for them so that her PCP would think she was. I know her PCP and know that they wouldn't have been a banana about it. We talked about how we'd rather know she doesn't want to take meds and see what other options we have, if there are any, or at least go through which meds are a must and which can be passed on. And also, don't waste your money on meds you're not going to take. That's not good for your health either. Story 65. I used to work in physical therapy. An extremely sedentary patient in her mid-50s who had a body type out of a Tim Burton film. Think like an apple on two toothpicks. She told me that when she was in the military in her 20s, she was the strongest person on her post. She said she could bench press 500 pounds. She said she was 135 pounds when she could do this. After I told her the bench press record for that weight class for women was 300 pounds, which is incredibly impressive. I offered that maybe she forgot and was thinking 250 pounds, which would still be incredible. No, she doubled down. She proceeded to tell me that she could leg press 900 pounds and overhead press 2 men sitting. For the record, this lady didn't even know how to perform a bodyweight squat in a pool with correct form. Doctors have read it. What is the weirdest thing a patient wouldn't admit? Story 1. Had a patient refuse to admit he swallowed a pen, even though an X-ray showed the pen inside of him and we took the pen out during an emergency surgery. Story 2. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago? Story 3. Once had a woman come in for a possible yeast infection. On exam, she had a glass bottle stuck inside of her filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, I think this is all a joke and you put it up there. Story 4. Not a doctor, yet, but was volunteering in the emergency ward, and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. Story 5. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions, but then would be out like a light seconds later. Usually in this case, we assume it's from infection, stroke, etc. But we still ask about substances use since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse, we cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that, still took her a long time before she said, well, maybe I did take some substances from a friend. Since then, I've trusted no one when it comes to denying substances use. Story 6. Not a doctor, but work in a radiology clinic. People always lie about having fasted for their appointments. They'll come in for their abdominal ultrasound and say they haven't eaten. You are literally holding a bag of McDonald's, sir. Story 7. How the remote control to a Zenith television wound up inside of a 54-year-old father of 2. They stopped making Zenith television sets years ago. From a medical perspective, why do you still own this remote? Story 8. This one is sad, for my old roommate girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they giving her a lot of pain in her last months. Story 9. Not a doctor, but a nurse. When you come into the hospital wanting to detox and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. Story 10. Only work records in a clinic, but we had a woman come in with a report of pussy odor. All well and good. It happens all the time in an obstetrics and gynecology clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. Story 11. Not a doctor, but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mom. Turns out she's in full-blown labor. Assures them she can't be pregnant, she's a virgin. The baby is literally crowning right there in her No maternity ward in their hospital, and she was in advanced labor when she arrived. And she still insists she's a virgin. Story 12. that they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. Story 13. Not a doctor, but many years ago was working as an assistant to an occupational therapist. We got a call out to help mobilize a woman who had been morbidly obese and was told to lose weight. We learned from the daughter she had gained weight, but her mother would refuse to come clean on what she was eating. All the daughter knew was that her mother may have been eating deep-fried food due to the vast amounts of cooking oil she found in the pantry. When we arrived, she'd gained an extra 6 kilos but insisted she had lost weight. She did not look it. Before we began mobilizing her and check her living room for trip hazards, she also had horrendous knees, we took a look at the pantry. Olive oil, peanut oil, sesame oil, any kind of common cooking oil you can find off a supermarket shelf. She had it, a vast stockpile of oil. We asked what she was frying with the oil. She insisted that she wasn't frying anything and that she was eating healthy since the oils she used were healthy. We had to explain to her that oils are still fatty and will still contribute to weight gain. After a bit of poking around the pantry, I noticed that for the amount of oil she had very little in food that could be traditionally fried. She also had little in other foodstuffs that could explain the obesity. I brought it up with the therapist, and the therapist then demanded the truth. We couldn't provide complete health care until we knew everything. She admitted that she thought healthy oils would help her lose weight and suppress the appetite, so she had taken to drinking the bottles of oil whenever she got hungry. Needless to say, we disposed of most of the bottle of oil and set her up for a home visit with a dietitian. Story 14. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids, they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit, and they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception, and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Story 15. Not a doctor, but worked in a hospital for a long time. Had a PT come in that had OD on substances. Was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an a-hole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew, but he was in absolute denial. He eventually heals up and transfers out after a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and asshole-ish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. Story 16. I volunteer at an ER. Prisoner shoved a ballpoint pen inside of him. Insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Story 17. I admitted a guy for chest pain. As part of the workup, I did a urine substances screen which came back positive. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by substances." His answer, "I didn't use substances. See, I was at a party and people had some substances out on a table. As I was walking by, an oscillating fan blew the substances into my face, which is why my urine was positive." Got it. Story 18. I'm a seat tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even asked none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has sex with men. Well, the blood test came back positive also. Surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her, and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. Story 19. Nurse here. Had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I ask all the routine questions for this complaint, lots of questions about his poop. Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, x-ray. Everything comes back completely normal, but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours, I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope. The kid just doesn't seem well, but we have no reason to keep him. We decide to watch him a little longer, let him eat. The kid eats a bunch, apple juice, crackers, popsicle, no pain. So we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions, and dad goes, "You know, for the past 3 months, he's had a lot of worms in his poop worms." Damn worms. You spent 6 hours denying worms. I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears. Could not wait to tell my resident. Deworming medications, a crap load of wasted time, and they were on their way. Story 20. I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened, so he might as well just admit it. I used to do patient registration in the emergency. 2 of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance, and my coworker takes it. So I'm finishing up some paperwork, and I go to our front office and pull up the patient tracker board so I can see what still needs to be done, and a new patient pops up on the board. Chief complaint. Eyeliner pens stuck in junk. My coworker walks into the office looking scarred. She explained the nurse asked him what happened and he said he slipped. She told him that doesn't seem likely, so he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on TV and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation. Story 21. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart or any other surgery. Story 22. Had a patient in hospital. I forget what for. The point is that he disappeared for a few hours. When he came back, he was tachycardic to 160 beats per minute. Massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say. We're going to take some blood and find out what you've taken. He then pipes up that the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with? Speed, he says. What do you know? Bloods confirmed that he had taken speed, but he insists he didn't take it. Story 23. Young girl refused to admit that she had sex or any contact. She was pregnant. In the end, we found out she was abused. Actually, kids tell the truth with my own experience. So if they lie, it has often to do because they are afraid to get any problems with their parents. Dinking. Or because they are ashamed and don't know what to say, to think, or to do. Story 24. Not a doctor, but a nurse. I had a patient that kept giving herself chlamydia repeatedly from using her sex toy once she'd been initially infected with it from a random partner. We asked her about any other partners and toys, etc. She denied until she couldn't anymore. Story 25. Had a 20-ish guy in the ed come in with excruciating chest pain and looked very uncomfortable. Denied any kind of trauma. Turned out he had a fractured sternum. When I told him we figured out why he was having pain, he said, "Oh yeah, I forgot I overdosed yesterday and my friend gave me artificial respiration." Story 26. Not a doctor, but a nurse. Had a patient come in with a toothpick in his junk. Refused to tell me how it got in there, insisting he was picking his teeth and it fell in. Story 27. That she could actually see. We had this lady that came into the ER at least once per month, usually cheat pain. She was 30, morbidly obese. She had seen multiple specialists. Had her heart-lung system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint, either last time she got a trip to the retina specialist. When I examine her, I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, "If you have your feet up like you always do, then the neuro exam." I have her touch her nose, then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose, then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked, and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Story 28. Pet rat bit them. Only found out from someone. Confronting him, her in front of the team, asking if the patient had told us about the rat bite. Patient looked like she wanted to hush the someone. Story 29. Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi, and the girl uses the jacuzzi and is inseminated. Story 30. I am a doctor. Not a single random thing up my ass is weird to me anymore. I've heard or seen it all. Nor is it that surprising when somebody is wacko enough to claim they got Lyme disease sexually from their husband, who got it vertically from his mother, and that's why they are sterile, if you aren't aware. This is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you at a decent pace. Plus, we found a snack wrapper in the inaccessible folds of your panis. Damn. Story 31. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey, buddy, you okay in there? Sink on full blast. Yep, everything's fine. I go back to his room a few minutes later, and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey, buddy, are you sure this is urine in this cup? Yeah, my pee is always clear. PT is wheeled off the x-ray. I checked the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on, little homie. You gotta do better than that. Story 32. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them, you can see a pack in their purse, and you physically saw them smoking outside before they came in for their appointment. That's not what annoys me, though. What annoys me most is that patients will Google what they think is their diagnosis, admit they did, get their diagnosis right, then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it, read the Wikipedia article, then still come in and demand antibiotics. When you confront them with this, they will pretend they didn't know that they read that antibiotics do not work. They do this with almost any disease in which the treatment is conservative management, and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. Roughly 80% of what comes into urgent cares can be managed at home with do nothing, rest, drink fluids, take Tylenol. Story 33. Maybe not so weird because the person was whacked out of their mind, but once had a patient who was clearly on substances and vehemently denying it. I'm not a doc, but I'm a lab tech and draw blood in the ed regularly. While I was drawing their blood, the patient was screaming at me to stop letting the green men that were coming out of my arm touch them. Turns out they were tripping balls, but underage, and refused to tell us anything for fear of their parents finding out. Story 34, not the doctor, but patient. Doctor asked me during a physical when my last test for gonorrhea and chlamydia was, and never asked whether I'd been sexually active. I'm a virgin, my doctor was cute, and for some reason I felt embarrassed to admit I haven't had sex, so just rolled with the recommended urine test. $250 and the expected negative results later. I felt really stupid. Looking back, pretty weird thing to not just admit. My doctor couldn't care less what my sex life was like. Would have saved me some money. Yikes. Story 35. Med student. Went to see a patient for my practice physical. These are all volunteers, and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room, and this older gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up, and he didn't move it. So I asked him about it, and he was like, "Nah, it's fine, see?" And proceeded to move it like a half inch. It clearly was not fine. I'm sweating now because these are mainly just opportunities to talk with patients, and they're supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me, but I was ready to call in a real doctor because I was freaking the duck out. Story 36. So in my story, I'm actually the patient not telling the doctor something, but I felt like it was good enough and relevant enough to share. But when I was like 13 or so, I ended up with a urinary tract infection, which was odd because I'm a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UTI. What I didn't tell them, and still haven't told anyone, except my wife, was that this happened because I was curious what it would feel like to shoot water up my junk with a hotel shampoo bottle. Not great, but if you pump air up there, it makes a mini fart sound when it comes out, so I guess that's a plus. Story 37. Kind of the opposite situation, but I had to go to the emergency because I couldn't keep anything down and I was dehydrated. Doctor asks if it's possible that I'm pregnant, and I said I am sexually active, but I just finished my period, so it was unlikely. She just stared at me for a second and started laughing. Apparently no one ever just admits they have sex and always tried to hide it for some reason. Turns out I had a kidney infection anyways. Story 38. Obligatory. Not a doctor, I'm a nurse. We had a patient come into the operating room for brain surgery, probably a mid-50 guy with a nice head of light brown hair. Before a patient comes into the actual, or we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off, because, brain surgery. And all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. Story 39. Middle-aged man enter ER in sweatpants. Worked as an accountant, but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier, but he hadn't followed through on the treatment and that he now wanted to get things taken care of. During the physical exam, I see a G fruit-sized mass in his scrotum. It was not subtle in any way. I call in urology and order a CT scan. I tell the guy that this isn't inflammation. It is a tumor, and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. Story 40. Not a doctor, but work in an emergency. One day, some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests, including a substances screen, which ended up being positive for TEC. The doc goes and talks to the parents about it, and they finally broke down and admitted that the kid had eaten an entire bottle of their substances gummies while they weren't paying attention a few hours earlier and was just high as crap. Story 41. Optician here. A few days ago, a man called asking if he could see an optometrist ASAP. I told him we had no spots left and asked him what seemed to be the problem. He told me he felt he had an eye infection, and it's been 4 days since he can't see properly from his left eye. Sometimes clients can complain from overbearing or swollen eyelids, but no. He told me part of his field of vision was off for the past 4 days. We have indicators, such as flashes of light or dark spots, that tell us if we are dealing with an emergency worthy of being sent directly to the hospital for emergency intervention from the ophthalmology department, and this was clearly it. I told him he has to go to the emergency room now. He tells me he has a busy shift at work and is a supervisor. I told him again to go to the hospital ASAP and to take it seriously. He tells me that he can't because his day will be scrapped. I told him to stop putting work over health, and that this needed to be dealt with now. He still argues with me and tells me that he doesn't feel like waiting in the emergency room for hours. In any case, if you have symptoms resembling a retinal detachment, you are seen almost immediately. I insist that he must go. He then tells me I'll go after my day's shift. I tell him to cut it out and go. He then asks me if it's an emergency and to tell him what he has. Given that I'm not allowed to give any diagnosis by the phone, I told him to hurry to the hospital. He told me he would, and I'm pretty sure he stuck to his plan of finishing the day. Retinal detachment can usually be treated if noticed quickly. Story 42. My parents are both doctors. One time my mom told me that there was nothing too weird that I could tell or ask her, because she's heard it all before. Her example: once a woman came in with severe intestinal cramps. Turns out she had 2 tampons shoved inside of her. She swore she only had one, and could hardly believe what the nurses told her they had found. Story 43. We caught a mother of a patient injecting poop in his son's veins. She obviously denied. She could do so because her and his son were well known in the hospital, so she gained the trust of the nurses. She was arrested and diagnosed with Munchausen syndrome by proxy. The poor baby is alive, but with development problems. Story 44. That they can't afford their meds. Yep, America. It's so weird. We can for sure tell you weren't taking them. It's put your life in serious danger, and if you don't fess up, it could kick you off the transplant list for non-compliance. It's such a taboo, I guess, to say you're poor. You had to pick lights or meds, food or meds, gas or meds. It sounds so simple, Doc. I just couldn't afford that in food. But it takes some work sometimes to get people to just tell us. Story 45. A patient came in due to abdominal pain. Though we're thorough in our examinations, some parts are omitted for obvious reasons. One doesn't check teeth for abdominal pain or check one's balls for a complaint of edema. Initial consideration was appendicitis. A few hours later, the patient's wife came up to me and whispered, "My husband is feeling a little timid to mention this, but he feels that one of his balls is a little bit sore." I went to take a look, and his balls were swollen to the size of a G-fruit. Turns out the patient had an incarcerated hernia affecting his lymphatics, leading to third spacing. That dude was taken straight to the OR. Story 46. Not a doctor, but I work with people occasionally in a hospital for other reasons. Criminals. Anyhow. One day I was sent to pick up a woman for transport to a different facility, and she was being treated a host of different things. She has complained of a lot of pain in the area where her colostomy bag was attached. I believe it's called a stoma. Again, not a doctor. Long story short, she was diagnosed with a host of things wrong with the stoma, and the doctors were all guessing how the hell she had gotten some of those complications. She eventually admitted to me and the rest of the room that she was still engaging in her lifestyle of an escort, and men would pay extra money to make sweet love to the hole. Yes, that hole. Story 47. Radiologist here. I've seen lots of weird things, but the weirdest someone wouldn't admit was the trauma patient, female, who got pan-scanned because she was altered. I saw a cube of gas and debris in her pussy, which did not look like a tampon normally would. After some thinking, I figured it was either some substances she was trying to hide, or potentially some weird foreign body. I advised the trauma team to investigate. They were not comfortable, so they consulted the GINs. They sent a first-year resident who asked the patient if she had anything in her pussy. The patient denied anything. The GINs reported back to trauma, who reported back to me that she denied anything there. I advised a direct visual examination, which occurred finally an hour later, at which time they found nothing. To this day, I have no doubt she had a leprechaun in there. Story 48. I'm not a doctor, but I work in the hospital. We have a regular at the ERA. She comes every single day. She figured out that we can't send her home before a doctor examines her if she complains of trouble breathing or chest pains. So she always does this. No ward wants her to come there, and no doctor wants to be responsible. She's super manipulative, treats the nurses horribly, and is very demanding. She's an addict and usually wants more substances plus someone to take care of her like she's at the Hilton. Her goal every visit is to get admitted. She succeeded a few days ago when there was some issue, self-inflicted, with her colostomy bag. To avoid being sent home, she smeared crap in her IV, trying to cause sepsis, just to stay at the ward. Story 49. A few years ago, I had one kid, maybe 17 years old, who evidently had heard of a challenge where you can fully insert a light bulb into your mouth, but when you try to pull it out, you can't open your jaw wide enough and the bulb shatters inside. Well, after about 3 hours of picking glass from out of his mouth, in every spot imaginable, gums, under the tongue, roof of the mouth, throat, etc., I asked what went down and he just would not admit that he put the light bulb in his mouth. His main story was that his friend must have slipped it in his mouth when he was sleeping and punched him in the jaw, however, upon talking to this friend in another room. He confessed that the boy had tried to beat the challenge. His friend even showed me videos of other people trying it. So I go back in with the patient and bring his guardians in this case an aunt and uncle, and explained the whole light bulb challenge without giving his friend up. When asked what I was talking about, I explained and said there are many videos on the internet about the exact thing I'm talking about. They also revealed that he'd tried several dangerous stunts and challenges before. But even still, the stubborn git wouldn't admit a thing. He was adamant that he had absolutely no part in his injury and that everyone was out to get him. It's just crazy to me how arrogant and thick-headed some people will get. They'll do anything before admitting to doing something that's stupid and short-sighted. Story 50. Not a doctor, but I work in a big, busy hospital. We had a 20-year-old obese woman come in complaining of severe abdominal pain. Before she was even examined, it became clear that she was about to give birth. Side note, my hospital does not have labor and delivery. That is at our other campus, a couple of miles away. This woman proceeded to give birth to a full-term 8 pounds healthy boy in our ear and denied that she was pregnant and denied that the baby was hers. The doctor said, "It's a boy." And she said, "That's not my baby." Needless to say, Psych was called along with a team from the other hospital to take the baby over to their campus. Story 51. Needed to do a substances test on a patient who came in with his pregnant girlfriend. Guy goes into the bathroom. A few minutes later, he comes back out with an empty cup. He goes back to his room to drink some water. Couple minutes later, he hurries back over to the bathroom with a noticeable bulge in his pants pocket. He comes back out with an adequate sample. So we run the test. It comes back negative. We then run a pregnancy test on the sample. That comes back positive. Dude denied his pregnant girlfriend provided the sample even after being told there can possibly have incurable disease if his urine turns positive on a pregnancy test. It was unbelievable. Story 52. I had an alcoholic on my ward. He was admitted with an alcohol-related illness, and he insisted he was going to stay abstinent after hospital. However, he wanted no referrals to any addiction help, and he was very vague about his strategy to stay alcohol-free. Admittedly, none of the staff really believed he would stay sober. Not in the least, because this was his 6th identical admission in the past few years. Forward a few days. A nurse reported to me that cleaning staff had found beer cans in his room, empty as well as full, and someone had seen him at the supermarket next to the hospital. They sold beer. I confronted him with these discoveries, and he insisted he had no idea where these beer cans were coming from, but he was adamant he had nothing to do with it. I expressed my concern about these findings in the light of his intended sobriety. However, according to him, I had absolutely nothing to worry about. It's sad because he's only in his 30s, and I'm convinced alcohol is going to kill him soon. Yes, I told him this. It's astounding the lengths of denial some addicts will go to. Story 53. Not my story, but a fellow coworker's story. This 360 pounds woman came in, well wheeled in as she was in a wheelchair since walking was so difficult due to her weight, complaining of severe stomach pain and itching. They took her in and started examining and asking questions as she's talking about the area that's in pain. They lift up a heavy roll of fat, and there were 2 Twinkies squished in there, all moldy and almost necrotic smelling. It was apparently there for nearly 2 months. Want to know what was inside those Twinkies? Maggots. Hundreds of them. All of her pain was caused by the maggots trying to burrow in her necrotic skin left untreated. We believe she put the Twinkie there so they would eat the Twinkie and not her necrotic tissue. She denied that she left them there, and has never eaten a Twinkie in her life. Kept going on and on about someone had stuffed them there while she was asleep. Story 54. I once had a patient come in with large calluses on the front of his ankles, which is a very unusual place to get calluses. I brought it up a few times because I thought maybe he was wearing his shoe wear improperly. but he kept waving off the question. Eventually, I got him to admit that the calluses are there because he recently started taking a prescription antidepressant medication, which made it very difficult for him to achieve satisfaction. He found that if he lay on his living room carpet with his legs bent out beneath him in a W fashion and pleasure himself for several hours, he was able to end. Story 55. Had a woman on my obstetrician gynecologist rotation during med school that had pelvic inflammatory disease. The cause? Well, she never admitted to it, but we believe that she was repetitively using unwashed sex toys to pleasure herself for weeks based on the culture that grew and her story not adding up. Story 56. Not a doctor, but work in a psych hospital. Walked into a patient's bathroom at 3 a.m. because he was in there for a suspiciously long time to find crap smeared literally everywhere, and he's standing there butt-ass naked staring at me. He swears up and down. He has no idea how it got there, and he was just as surprised as I was. I just walked out, called the abuse code team to come hose him down, and called the environmental services to come scrub and sanitize the bathroom. The entire time, he's still in full denial. He did not do it, even though they literally had to SC crap out of his fingernails and out of his eyebrows. Called the on-call doctor, who ordered him to be a full one. One observation from then on out, so congrats, buddy. You now have to have someone watch you eat, sleep, and crap for the next few weeks. Story 57. I'm a doctor of dental medicine. You all damn lie to me about flossing. One guy who swore he didn't know why he was losing his teeth because he was brushing twice a day caused me to get heated. I have him a mirror, scrapped a chunk of plaque off his teeth from his gum line, and showed him a big heaping pile of plaque, proving that he was not brushing. I gave him the benefit of the doubt and told him I would show him how to brush, and he turned it down because that couldn't possibly be it. Some people just want dentures as fast as possible. Story 58. Had a first job out of school doing Medicaid risk assessment for insurance companies. I basically had to do complete family, social extensive reviews, and complete PE and head to toe, and make any new preliminary DX and referrals for the insurance company in 60 minutes. Very taxing, but it definitely helped me hone down my skills in getting information from patients quickly and efficiently, and especially with my charting. But that's a different issue. I have this one patient, and doing my thing getting their family history, etc., and get to substances and alcohol use. Normally pretty good disclosure about obvious things, especially if they are being treated for things like alcoholism, etc. I get to smoking history and expect to hear 20 ppd for 15 years given the smell in the house and the substances on the table. Dead-ass woman with a 10-month-old on her lap looks me in the eye and says no to any and all smoking history. I stop and look at her in the eye and say, "Are you absolutely sure? What's this?" Points to substances. Yeah, that's not mine. You live with someone at all or roommates? No. Oh, okay. I had gone over my self-imposed time limit on that charting section, so I just wrote down no in the chart and had her DX and referred for substances abuse. I wasn't about to argue with a woman who couldn't admit an issue so clearly right in both our faces. Story 59. Real late here, but I am a nurse and we just had a patient, mid-50 male, strictly pooped in diapers. When asked why he said so, he can freeze them. Ends up he has a deep freezer in the garage full of poopy diapers. He also works for housekeeping in the hospital. Story 60. When I was a medical student, we had a patient on one of my rotations that was getting oral pain meds, but insisting that we switch them to a stronger IV pain medicine because they had been getting nauseous and vomiting up all their meds. When our team rounded on the patient to check on them, we walked into the room and were quickly greeted by an eager patient that had been waiting to show us their vomit bag. Turns out that it was filled with a lovely mixture of piss and crap, and topped off with a handful of pills the patient had thrown in there to make it look like they couldn't keep the meds down. When we called them out, the patient was in total denial and tried to reason with us that it must be vomit since it's in the vomit bag. Story 61. Nurse here. One of my coworkers was a student nurse on our med-surg floor at the time. She had this patient who called out saying the student nurse had lost the PT's phone, kept insisting, and it got to the point that risk management was getting ready to be called because she was going to file a complaint, etc. Student nurse swears she never even saw a phone, didn't know the lady even had one. So several of us went in, tore the room apart, looking for it. As patients often lose belongings in their bed linens, we began taking each blanket, sheet off, and shaking them out. At this point, the lady refuses to get out of her bed so we can take off the bottom sheet and check between the mattress and bed. She suddenly is too weak to stand, so we assume the standard position used to roll patients so a bed can be made while the PT is still in it. The patient is first rolled to the left side where she's facing the accused student nurse. Another coworker was on the side where the woman's back is facing and she happens to hear a phone start ringing. We think it must be under the woman or under her mattress. Still can't locate it, and all the while she's screaming her head off about how this hospital is going to buy her a new phone and she ain't accepting no cheapo generic one either. Upon rolling her to the other side, the student nurse sees a black dot on her bottom. Yep, you guess it. Her cell phone was shoved inside of her, and the ringing we heard was from inside. No one says a word except, "Oh, look, we found your phone." She swears it's not hers and that we planted it there so we wouldn't have to buy her a new one. It was a flip phone, and the black dot was the pull-out antenna. Story 62. Had a patient on our service for a heart failure exacerbation. We weren't sure why she had one now, as she had been stable for a few years prior. She also had a documented past use of substances, so we checked a urine substances screen. The screen was positive, and the next day I rounded on her. She asked me why she had the exacerbation. I told her it was likely due to her substances use. She was shocked that I would accuse her of using. I brought up her positive substances test, and she insisted it was a false positive and told me she must have picked up the false positive from a toilet seat. That's not how any of this works. Story 63. Volunteering as an RSO and medic during my local range club's open weekend. Git rested the barrel of a .22 on the toe of his boot for a picture and hit himself in the foot. Claimed it was a sniper. I told him that the entry wound was straight through the top of his boot and asked him where shot came from. They must have a stealth chopper. We need to call the cops. You were inside when it happened. I saw you do it. Story 64. Patient refusing to admit he's continuing to drink water despite being on fluid restriction for congestive heart failure. He would take a rag, soak up a bunch of water, put it on his forehead as if to cool down, and then squeeze the water out so it would run down his face and into his mouth. Doc, I just don't understand why my weight won't go down. This is water weight we were monitoring, not fat weight. In a heart failure patient, you try to find a weight at which her heart function is optimized, and then aim for this weight, which over the short term of a couple days is largely reflective of the amount of fluid water in the patient. Very odd. We wondered if it was almost subconscious. Story 65. When I used to work in a Navier, we had a woman who came in complaining of abdominal pain. She'd only speak to the nurse, and I soon wheeled her over to radiology to get films of an obstruction. No one was given any information beyond that. I soon found out why. The rad tech took a couple of shots and we saw it. She'd lost a phallic-shaped object up there. She tried a few shots, but couldn't get a really good image of it. Finally, after the third shot, the rad tech stomped into the room and said, "It's still on, isn't it?" It was 3 a.m. The tech had worked all day and was woken up to take the films. Was it Ted's mom who said nothing good ever happens after 2 a.m.? The patient sat up as straight as she could, held her head high and said, "I have no idea what you're talking about." How I finished that shift without passing out laughing, I'll never know. Story 66. Not a doctor, but this happened to my friend. My friend was in a really awful car accident. She was hit head-on by a huge pickup truck that was going 83 miles per hour in a 40 miles per hour zone. The driver had passed out at the wheel. When police arrived at the scene, my friend had several broken ribs. The other driver was unscathed and still passed out at the wheel. The police found open alcohol containers and substances in his vehicle. He didn't wake up until the ambulance had already arrived at the hospital and he was inside. The doctors, who had been informed that he was under the influence, asked him if he remembered anything. He told them, "I have low blood sugar, I must have passed out." And then they did a substances test and found he had been using everything they found in his car. Story 67. Not a doctor, but friend of a patient. I had found her in the bathroom after an attempted to death. When I found her, she was drifting in and out of consciousness. En route to the hospital, I'd called her parents letting them know about the situation, and to my disbelief, they wanted me to lie and say that she had forgotten that she had taken too many pills, and that's why she was non-responsive. I refused to do so, but by the time I arrived at the hospital, they were already there and were the ones who gave an account to the triage about what had happened. In the air, I lied and said that I needed to use the restroom before flagging down her attending and telling him what had actually happened. Not that I'd actually needed to do so because the doctor wasn't an idiot and knew what had happened by just one look at my friend. A referral was made to a psychiatrist, and by the time my friend was fully conscious again, she was sent to a psychiatric facility for monitoring and treatment. Why lie about it?